Hello, my name is James C. Franklin. I'm currently an associate degree nurse pursuing my Bachelor's of Science in Nursing at the University of Kentucky. This is my Capstone project, Modalities to Alleviate Stress and Nurse Burnout in the Acute Care Setting. I did this as well as my 40 assigned clinical hours at my current place of work, Clark Regional Medical Center. The Clark Regional Medical Center is a level 4 trauma facility located in Winchester, Kentucky. This is a 79-bed facility comprising of an ER, an ICU, pre-op PACU, OR, medical surgical, and a labor and delivery unit. My function in that was education and rapid response. To elaborate on rapid response, a rapid response RN responds to clinical deteriorations in concerned RNs in any unit of the hospital. This can be an ICU, medical surgical, labor and delivery, pre-op PACU, anywhere inpatient. Basically, when an RN is concerned for their patient or identifies a declining patient, you and a healthcare team member comprising of ancillary staff as well as multiple rapid response RNs, physicians, house supervisor, everybody goes. And you quickly assess and identify problems that the patient is experiencing. You either intervene there or you transfer the patient to a higher level of care. This can be the ICU, or they possibly need to go to UK. They might need an ICU. Technically, they might need ECMO. We might need to send them off for that. So yeah. Education. I worked in the educational department doing policy implementation and review, as well as educating staff members and new RNs. We also held a few meetings that I'll identify later in the project. Learning goals and objectives. There were 3. The first was to identify causes and triggers for stress in nursing staff. The second was to assess the level of stress in nursing staff. And the third is to identify and apply interventions to release stress and prevent nurse burnout. To prevent it, we have to know what it is. So what is nurse burnout? Healthy Nurse, HealthyNation.org defines nurse burnout as a state of emotional, physical, and mental exhaustion that stems from work. This is typically associated with some current buzzwords in healthcare right now, such as compassion fatigue, and though linked to depression, nurse burnout does not mean depression. Nurse burnout causes depression. So the initial step was to do an initial survey. The pre-survey consisted of 4 questions, 2 quantitative scaled questions of 1 to 5, and then 2 write-in questions. They were given to 60 RNs of inpatient as well as emergency department. They're distributed to the ICU, ER, OR, and medical surgical. Of the 60 I sent out, I got 27 back. I was actually happy with that. 6 from the emergency department, 5 from the ER, 3 from pre-op and PACU, and 13 from the medical surgical unit. The 4 questions. The first one on a scale of 1 to 5. Do you feel like you've experienced burnout in the last two years? 65% stated that they have most likely experienced burnout in the last 2 years. The second was, how likely on a scale of 1 to 5 do you feel about leaving the nursing profession? This was the most concerning answer that I got. Around 35% of RNs stated they were somewhat likely to leave the nursing profession in the near future. This is when I really started to identify how pervasive the problem of nurse burnout is in our profession. Because this is one hospital. You lose 35% of a hospital. I mean, you multiply that times how many hospitals we have in the greater Kentucky area. How many nurses is that? That's thousands. We need to do something. The next was, are there any factors that are currently affecting your level of stress that you experience at work? The main factor identified was the pandemic. As we can all agree, it's been very stressful on all of us, all healthcare team members, everybody outside of nursing, everybody outside of healthcare. It's been rough, and that's what they identified. The fourth was, are there changes that can be made to decrease the stress you feel at work? The first question is something I really couldn't do, is increase staffing. They don't listen to me for that. But the second was providing a better place to relax during a shift, which is something we work on in a later slide. So after that, I decided I should conduct peer interviews. I conducted 3 peer interviews. The qualifications for my peer interviews were pretty simple. I wanted 1 from each department, an ICU, an emergency room, and a medical surgical RN. The main thing I wanted was they've been at Clark for 5 years. This showed me that 1, they've been a nurse for 5 years. They like it. They stuck in it. 5 years is a considerable amount of time to be an RN. It also shows that they're loyal to Clark. They like the facility. They enjoy working here. And the third thing it showed was they nursed through the pandemic, and they were a nurse, and they were an established nurse before the pandemic. This was vital because the third question of the survey identified that, man, the pandemic stressed everybody out. It caused a lot of problems in nursing, which we all already knew. I wanted them to be able to talk about the pandemic and how it's affected their nursing. The main things highlighted were the increased mortality. Everybody lost patients. It was everywhere, all the time. The next was they didn't have family members. A lot of people relied on patients being able to be with their family members when they passed, and not having that, and that barrier between families of you're on the phone, you maybe can FaceTime on an iPad. That's not enough. We get into this occupation to help people, and they all stated that it just made it a lot more difficult. Inquiries regarding suggested changes. I was able to kind of use the fourth question as a bouncing platform in the interviews to drive my research. And I focused on the second most common, which was the implementation of a more peaceful place in the workplace. And as you can see, the best practices to prevent nurse burnout, the main one I worked on was the Serenity Room, which was an improvement of the break room. This is, I think, one of the most important interventions I applied because research supports the effectiveness of improved break room. Salama et al. Reported that improving both staff break policies and the environment they are able to take a break can decrease job-related health concerns, improve job satisfaction, retention, and performance. So, making a break room quieter. No alarm should be in the break room. There will be nurses out there. Not everybody's going to be in the break room. Changing lights, more calming colors. Allowing a nurse to put their feet up. This allows an RN who's having a rough day, maybe had some difficult conversations with a family member, has a difficult patient, a really sick patient. This allows them to, even for a few minutes, just get away, put their feet up, and take that stress on their shoulders and put it off and go back out to work and take care of patients. The second intervention was a cumulative stress debriefing. I was lucky that the current AACN magazine came to my house, and it had a study by Arbios et al., which is the effect of cumulative stress debriefings on a pediatric intensive care unit. To elaborate, a cumulative stress debriefing is a pretty frequent monthly or so meeting that takes place with RNs that allows unit RNs to talk about what's going on, talk about their stress, talk about what they're feeling, to vent, to really say like, hey, this is a problem, this is what I'm dealing with. And the best part and the most important part is management isn't there. Management is not in cumulative stress debriefings. It is just a third party, typically case management or somebody else in a senior committee trained to deactivate stressful situations, to calm people, and overall create a safe environment. This has shown greatly that the correlation between cumulative stress debriefings attendance and decreased intent to leave the nursing profession. These are two things that I'm currently working on implementing. The Serenity Room, the medical surgical break room is going to be actually renovated this year. It's in the workings right now. And I grabbed the medical surgical director and presented my information and showed her the study regarding Serenity Rooms, and we're going to find more relaxing ways to paint, possibly get rid of all the alarms, give stools, allow nurses to set their feet up, and really make a relaxing place. R&R times for floor nurses, I'm currently working on presenting that in a more effective way to our director of nursing to hopefully start those. The next is workplace education on mindfulness, meditation, and relaxation yoga. This was my easiest intervention. I just told my managers that I was going to put up a poster in the break room, and they said go for it. This was also provided some education to RNs as well. Cushier et al. States that in addition to improvement in physical problems and in quality of sleep, both stress levels and burnout were consistently reduced in subjects who practiced yoga and mindfulness. My intervention for this was, after reading this study, I created a poster of some simple poses and elaborated on meditation and put it in the break room. the ER break room, the medical surgical break room, ICU break room, as well as the pre-op and PACU, and the physician lounge. I actually went into the physician lounge last week, and my provider was doing the tree pose. I thought it was kind of funny. This is my poster, the use of yoga to combat burnout. My motto here was kind of to namaste the stress away. And this, I dictated three yoga poses, 2 that can be done in the clinical setting. This one should probably be done at home for infection-related purposes. And then I also talked about meditation and explained how to meditate. The main grab away from that was to reach within and grab onto a spark of strength. This poster allows a nurse to come to the break room who's having a stressful day to really just get away for a few minutes, to relax and to meditate, and to hopefully relieve some of that stress that they're experiencing. The alignment of the project with course materials. So, very applicable. Our Module 1, the first assignments we did in the class were focused on nurse burnout and depression. 2 very related things, as you can see. They were highly applicable on my project, and kind of what really brought that to the forefront of my mind on what I needed to do. The next were legal and ethical, as well as duty to disclose. This was really the perfect time to have this course. We're talking about nurse burnout. That's just everywhere in our profession right now. Legal ethical, we're dealing with a case that is going to have ramifications in our profession for years to come, the Redonda Vo case. And being able to do legal and ethical courses while reading about this. And we actually had a meeting with compliance, legal, and our director of nursing, as well as all of our nursing staff, regarding this case and the impacts it's going to have on our bedside care. Our legal team actually directly referenced to Eris Heeman, which I had read 2 days prior in our assigned readings. She agreed with the sentiment from that article, as punishing nurses isn't best for nursing. That's not how things move forward. Regarding teamwork and nurse leadership, teamwork and rapid response, it's imperative to have closed loop communication and trust with your providers, with your ancillary staff, and nurse leadership. Educating oncoming RNs is directly applicable. Takeaways from my clinical. It was wonderful to function in rapid response. I find it a very important part of nursing, as it really improves patient outcomes when they're done effectively and identified quickly. It was also wonderful to work in leadership. That's a place that I see my career going, hopefully, in the near future. And to work in education and leadership was truly wonderful. I spoke earlier about my view towards education. I think it's more imperative now than ever to have easily accessible education and more teachings for our staff. It was also wonderful to have people agree with me and want to implement what I'm presenting, and to be heard and to have a voice regarding nurse burnout. It showed me that we're working on this. This is something we're going to improve as a team. And when I presented these to our management, they were accepted with open arms, and it's something I was truly not expecting. And to have my voice heard like that is wonderful. To elaborate again, thank you so much. These are my references regarding the cumulative stress debriefings, the yoga, as well as the screening room.